Hi guys, thank you for joining. This is Essence of Medicine, and today we're talking about the power of positive thinking. I'm Amanda Armagast.
I'm Mohammed Noman Bashir.
And I'm Dr. Abbasi for Essence. You always have the best subjects, Amanda. Tell me about why did you choose this subject?
Thank you. I chose this subject because it's pretty close to my heart. Obviously, everyone here knows that I like to talk about positive thinking and mindset. I've gotten in a little bit of heat actually for talking about mindset. So I wanted to talk about, like, kind of get technical about why positive thinking is good for your health and how it can benefit you, especially after something like surgery.
And as well, why it is not mumbo jumbo. It's why it's not, esoteric nonsense. It is real. That you have another name for that you often use. I think I have heard you talking about manifesting something.
Oh, manifesting. Yeah.
So tell me about that. What is that?
So manifesting is pretty much, in complete layman terms, like very untechnical, thinking about what you want and receiving what you think about. So it can go either way. You can manifest good and you can manifest bad. One example, which is super minor, a lot of times I'll be driving and I am a fast driver and I start thinking I should slow down. There's probably a police around the corner. I'm not kidding. Every time I do that, there's a police around the corner and I don't get pulled over. And actually, it's happened to me one time. I'm knocking on some wood so I don't jinx it, but it's happened to me one time that I sped around someone because they weren't driving slow, but they were driving slower than me. I sped around them and they sped up to me and I was thinking, I'm going to slow down. I think there's a police around. We were going side by side. The police pulled him over. Yeah, but that's just one way about manifesting. So that's not very good or bad. That's kind of just neutral, but I want to have a good day every day. So I tell myself I'm going to have a good day every day. And if you say it enough times, if you truly believe it, it will happen. But on the other end, like, if you are constantly worried about, for example, your partner is cheating on you and you're constantly thinking, he's out cheating, he's out doing this, he's out doing that, you're actually putting those thoughts in the world. And then it's more likely to happen because you're asking for it. Sorry, one more part of my tangent. Bob Marley has this song, and in the song, he says, if you pretty much, these aren't the exact words, if you fight and argue every day, you're praying to the devil, I say. And that pretty much means like whatever you're saying, whatever energy you're putting out there, that's what you're asking for.
Well, I'm going to give you something very similar from my father. I remember when I was a child, and at that time, I was always making fun of my father. I wasn't wise enough. When we would get in a car to drive, he would make a prayer, literally pray to God, and then they would say some certain words, and then he would do this as if he was spreading the good omen around before we get into the car so we don't have an accident.
That makes sense.
Well, it didn't make sense to me when I was a child because I was thinking about God had better things to do than just you drive good, you drive well. Okay? You should drive okay and be careful. Don't put it on God, you know? You want to drive like an idiot and then make it God's responsibility.
You
for
run
you
the
to have
red
an
light.
accident.
You run the red light and you're like, why did God let me crash? Like,
Well, but you see that there, I wasn't wise enough. I was thinking about that, in that moment that why would you put it on God? Okay. But what I understand now, my father was in a state of mind, okay, we are driving. Driving is dangerous. Danger should be avoided. God, please help me. It was not having an accident to him was enough to pray to God for that. And that actually primed his mind, primed his. Now we understand that our brain get primed. Like, there is a saying that if you learn a new word, like a word that you didn't know before in any language, there is likelihood that you see 3 times in the next 48 hours. Everybody has experienced that. There was a word you never knew, now you know it, and you will see it again and again. It is not like you didn't see that word before, but now your brain is primed to see that word, to recognize that word, react to that word. And that was what my father was doing. He was priming and putting his in a state of mind that driving, danger, God, please help me. And that probably saved our life in Tehran's traffic a lot of time. Okay, if it wasn't the God, it was that it was important enough for my father to pray about and ask even God's help. Okay, now we understand these days that our brain is like a sieve, like things go 99% of the thing that comes to our sensory that goes through. We can adjust that sieve. We can prime it and say, this is what's important, this is what's not important. And when it's something is important and we put our mind on it, it is what you would call manifestation. What my called was prayers and God's help, and what the neuroscientists called practically priming
Yes.
of your brain. That and that is not that is a proven thing. And now it goes way, way beyond what we just talked about. Now, Dr. Bashir, lots of people talk about the power of prayers.
Yeah.
Do you have something? What is your take on this? Now, tell us a little about yourself before introduce yourself to us.
So, hello guys, this is Dr. Mohammad Numan Bashir from Pakistan. I'm a visiting doctor and a research student here at Inspired Spine. So, as quite rightly pointed about by Dr. Abbasi, that all his childhood, his dad made him pray before they went out to drive. Actually, 100% similar situation happened with me and all my siblings. So early in the morning, my dad used to get up early, and I belong to a Muslim household. So they used to pray Fajr prayer, and after Fajr, he used to drive us all the way to the school. And right before, like when we get into the car, he made us all pray the same prayer that you used to pray, first in Arabic, and then after a few years, my dad said, first you will recite it in Arabic, and afterwards you'll be reciting it in English as well, because they were so-called, they must know what it means in English as well.
Okay,
right?
what is do you know the English version of it? You want to say?
Let me, yeah. So it was something like that. Something I just, if I recollect properly, it was, oh God, to you we pray, make this journey safe for us. And we have no command upon it. It's you who has the entire command upon it, and guide us to the right path.
Okay.
It was sort of this. I'm actually forgetting exact words, but in Arabic, I can actually recite if you say. So my dad was also pretty much concerned that since early in the morning, I am going to drop my kids to school, so something bad might not happen. So let us pray to God, right? So that he showers his blessings and protect us. So exactly, sir, 100% same stuff happened until I went to a cadet college. It's a boarding school where it's in all Pakistan. I just got a rank there after an entrance examination. So until I went to that cadet college, it's a boarding school. Before that, every day I had the same routine, saying the prayer. And it wasn't until when I came to med school and met some really great friends of mine who actually changed my perspective and thoughts regarding my beliefs and stuff. So, yeah.
I think you've told me another really moving story about your dad relating to prayer. Do you know what I'm talking about?
Can you just elaborate a bit?
About your dad, he was ill, and then everyone was praying for him, and he got.
Yeah. So actually, my dad was suffering from multiple myeloma, final stage. And it was like he was in a lot of pain. And I knew it that he'll be starting this particular chemotherapy, like lenalidomide and Revlimid, like zoledronic acid, and the one we have this proteasome inhibitor, bortezomib, he'll get fine. But you know what? After suffering from 5 months of pain, he didn't, because he was so I'm sorry, I'm using this word, but he was somewhat stubborn, because he says, I am super fit. I do not need to see a doctor. And that time I was in 4th year of med school. So I was saying him, you need to see a doctor, because this is something pretty much concerning. He had all the symptoms of multiple myeloma. There were lytic lesions on his x-rays. So I thought, and at that time it was pretty fresh knowledge, because I just studied that disease. And I thought, when my teacher, who was herself a hematologist, actually diagnosed it 5 months before he actually visited a doctor. So when the pain got out of his control, he says, okay, now I need to see a doctor. So I say, like, the prayers didn't make a way for you. It were those drugs, actually.
But I think that all the prayers helps him to be positive, helps him to stay in a good mindset, which is so necessary for healing.
So this is the point of our today's podcast, that all those 5 months that he did not visited a doctor and he was staying at home, he thought that prayers are gonna make a way for him. And actually, on a personal level, prayers are good, that they actually give you sort of comfort, psychological comfort. They boost your energies. But as what Sir said, they may or may not translate into what actually is the reality. So
let's dissect this, because we are on something. And I want to use the example of your father.
Oh, yeah.
Let's say you have sepsis. We know what sepsis is. The bacteria are in bloodstream.
Oh, yes, sir, definitely.
Now, if you have a sepsis, you can pray all you want. You'll die. You have like 99.9% mortality with sepsis. All your friend can get next to you and start putting hand on and do aura and so on. Okay, you will die. You have sepsis, you will die. But let's not have sepsis, because that is extreme. Let's say you have a mild infection that is not sepsis yet. Amanda, like you had multiple, bruises and so on. Like you go work on your garden, you have a small infection and so on. What do you decide? What makes the decision, or what is the most fundamental thing that make that small infection go away? Your body fights it, or it becomes a sepsis? Your immune system, correct?
Yeah,
definitely.
Okay, so now let's talk about that area now, your immune system. There was this study done in 70s from all places, and not surprisingly in Austin, Texas, I believe. I have to look it up. But what they did, they took a bunch of college students, and the psychology department in Austin was one of the best. And that was in 70s and 80s, where we just start understanding the immune system and immune factors. This is literally going really much in your direction, Amanda. Sometimes you and I have disagreement about your way of life and your way of, looking into life, but this goes your direction. So they took this 20 kids from college. First, they let them fill out a questionnaire, and then divided them in 2 groups, optimist and pessimist. People, based on the questionnaires, they say these are everything dark and so on, and then like me, and then the other group like you, all sunny and so on and so forth. Now, they showed them a short movie that can have an open ending, that can go this way or that way. And then obviously I asked them, how do you think the movie is going to end? Not surprisingly, pessimist, they said, okay, that person is going to die and it's going to go bad. And the optimist, like you, they said, oh, he's going to survive, and then they're going to come together, and so on and so forth. Everything going to be great. That far, not surprising. But they measured the immune factors in their blood before and after. Same movie, same event. The optimist, their immune factors increased. The pessimist, their immune factor decreased. And guess what? What decides that a small infection becomes sepsis or not?
Immune
Your
factor.
immune system. Your immune system. An immune system is made of many things, but they measured certain immune factors that shows how potent your immune system works. What fights cancer? Our immune system. Now, let's put it this way. If you have cancer that is all over your blood and so on and so forth, prayer alone is not going to help it. As a matter of fact, we have a saying in Iran, where I grew up, is that, God will help you, but you have to move first. So, meaning that, like driving, don't put it all on God. You have to drive safe. But what we are talking about here is the true power of positivity. What that means is like what this study showed, and this study is not new and has been, we have a lot more information regarding that. Your attitude toward life, your attitude toward an action causes biologic change in your body. And then we get very close to your manifestation. You think positive, your body can fight it better and faster. So, the hardcore, the biologists and hardcore, I would say, rationalists, they just dismiss anything of, prayer and so on, and even positive thinking. I see the thing is all fact biology, but I think we know now that they are not right. Now, having said that, I don't believe prayer alone can cure, multiple myeloma.
Well, same with manifesting. Manifesting has the same rule that you can manifest all you want, but you still need to be the one taking the actions. You
Yeah.
still need to do something yourself.
Actually, I would like to say, as Dr. Abbasi just mentioned, that God will only help you if you first do your work. So let's suppose in India and in Pakistan, and it's pretty famous proverb, because I used to quote it in my English essays during childhood. So it's a very famous proverb. It says, God helps those who help themselves.
Mhm.
Yeah. So there is an old story that it reflects in American culture a lot, and that has been told again and again and again. This is an old story about this child with his dad is in the baseball stadium, and baseball is big in the United States. And the famous game, and I think there is a person that throws the ball. What are they called? The person pitcher.
The pitcher, yeah.
Pitcher, yeah.
Right.
The pitcher goes there. It's a final throw which determines the course of the who wins that thing. And the guy bends the knee and start praying in the middle of the stadium, and stadium goes silent. The child is asking his dad, what is he doing? I mean, he's praying, obviously. A child asked the dad, what is he doing? Says he's praying. And the child asked, something to the effect, does that help, or will God help him, or something to that effect? And the dad's answer sums it very good, very well in that regard, that says, yeah, does the prayer help? How much does the prayer help? Something to that effect. And the dad says, not a goddamn thing if he cannot throw. If you cannot throw, you can pray all you want. But if you can throw, if you are almost there, I think just the fact that you're concentrating, like meditating, like praying, like bringing all your faculties in one place, can give you that additional boost to make it or not make it. So and then on the other side, we have to as well understand that like again, it comes all back to, if you have a sepsis, you pass the praying level. You need antibiotic. You need heavy guns and so
fluids.
Mhm.
Yeah.
But there's
Vasopressors.
other levels to it as well. Like when you're positive, you're less stressed, so your body can function a little bit easier.
Yes, absolutely. And we have we have we know when you are stressed, you have certain hormones, especially, cortisone and so on, high in your body. Cortisone is a hormone that does a lots of things. It heals things. It literally, it actually regenerate your tissue. Okay. But having high level of steroid all the time, your body is so concentrating on trying to fix things, and that it's in a recovery mode. Your body's in recovery mode, and that is why we understand that trying to relax, trying to meditate, trying to all the things I cannot do has actually positive impact on your body's level of performance.
Right. And even if you zoom out a little bit, like imagine if you're someone who's just stressed every single day versus someone who's positive every day. If you're constantly in a state of stress, now your body is under the stress. Maybe you're being more depressed, or you can't eat healthy, or you're not doing the things that you enjoy because you're so stressed out. Whereas if you're positive, you're kind of excited to like for the next thing that you get to do. So now you can enjoy more things, you can be more active, and you can also eat healthier and just live overall healthier.
Yeah, and on the medical side, I can tell you something that really reinforced on the medical scientific side. So, Dr. Bashir, when we do, have you had a chance to look at our pain management protocols?
Yeah,
You
actually,
look at that. Go ahead.
yeah, actually, I actually discussed with Alyssa. She told me, but I haven't actually read it.
Yeah. So, but if you look at it, we don't.
I know the WHO protocols actually.
Okay, well, you know that what the adjuvant therapy or adjunct therapy to pain is, right?
Definitely, sir.
What do
Definitely.
we give? What do we give to pain? To pain people we are treating their pain. We for a long time we just used to give them typical pain medication like non-steroidal,
Yeah.
narcotic, and so on. But
Yeah.
we do much more these days, right?
Yeah.
Like you will see next week when we are doing surgery in our surgery center. This patient go home within few hours,
Few
but
hours.
they will not go home if he cannot manage their pain. So we have a long sheet, the list of things that we give to this patient. Some of the stuff we give them, they're not pain medication at all, like Flexeril or Robaxin. Do you want to tell us what do you think? What do you think what they are? Robaxin and Flexeril.
Like
Maybe
the generic name?
well, no. I mean, and since you're in Pakistan, sometimes you may have medication with a different name and so on. Do you know what Robaxin and Flexerils are?
I don't know the generic name actually.
Yeah, they are muscle relaxant.
Oh, muscle. Oh, yeah. So we can we basically give these muscle relaxants like tizanidine or baclofen, or we can have this famous chlorpromazine and these.
Yeah, chlorpromazine, that's Robaxin. Now, Amanda, what we do with medication, what you do with meditation, we do with medication. That's a catchy thing. Yeah, that's a catchy thing. You should make a TikTok that what doctors do with medication, you do with meditation.
Yeah, that's a good one.
Yeah, make that one. You relax. We give them medication to do that. Now, there is another medication that we give them, hydroxyzine. This is not a medication for pain at all. It's a anxiety medication.
Anxiety, yes.
Yes. What it does, it just take your mind off the pain so that you require less pain medication. We found out with the pain patient who are in pain, especially after surgery, you have to pump them so much with narcotic. Sometimes they quit breathing. It happens still today in the United States, every day, somewhere in the United States. But what we found out, if you give them additional medication that are not pain medication, but they are like muscle relaxant, anxiety medication, some other medication, they require less narcotic to be comfortable. Then you keep them away from that danger zone. So, and if anybody, question the power of prayers, good thinking, meditation, and and especially what makes people really relax if they have all their family around them.
Yes.
And if they have a feeling that everybody's thinking about them. Just imagine you're sitting in your house and thinking nobody thinking about you, everybody hates your guts and so on. And then another scenario, everybody thinking about you, everybody wishing you well and so on.
Mm.
Just
Yeah.
the idea here is that you are loved and people are paying attention to you. That is enough to reduce the amount of medication you need and all
Right.
the side effect that the medication you need. So I don't believe any true, honest doctor or scientist would ever dispute that these have tangible impact in your personal life. Now, but it goes another level that is not scientific anymore. Imagine, you love somebody enough to pray for them, or think about them, or manifest for them, or do even your witchy stuff and take their hair with honey and so on, and do it. How do you call that thing, Amanda, when you do
A spell.
spell? Put a spell on them. Let's say you care enough. That person must be in your mind enough. What that means that if there is something that that person needs, and you care about enough about him to have it in your mind, and you come up with a solution in your day, you're thinking, you see something like that person has a multiple myeloma, and you care enough about them that you see a new medication came on the market, a new doctor just opened up, and somebody who's a specialist just opened up a practice. When you connect those two dots, you are practically increasing the chance and the likelihood that that person will benefit. That person just copied his. Now, imagine me. I'm sitting here, I see something, I have access to certain resources, but now all of a sudden, I have access to the resources that you have because I am in your mind.
Right.
And that's what the friendship is, that's what the family is, but that the community is, that is what the the people who go, and it's well known that people who are a part of a community overall, they wither better hard times than people who are alone. Okay, so as a super rationalist myself, I'm just telling you that whatever makes you feel better, keep doing it. If it's a prayer, if it's a meditation, if it's yoga, and you took me once to yoga, and it was torture for me, Amanda. But I think if that helps you, keep doing that, because it will have literally tangible effect in your life.
Definitely. And you can always come to yoga with me again. You might enjoy it once you go more. But I actually heard that being an optimist can help with recovery from surgery, not just because of what we already talked about, like the immunity, things like that, but also that people that are more optimistic are more likely to follow the recommendations and guides by their doctor. What do you think about that?
Well, I think you're going to the place that it's called trust. Okay. You, as a patient, you are very vulnerable.
Yeah.
You have to trust somebody. We know that if you are not relaxed, if you have a bad attitude or pessimistic in life, one of the things you do, you're in danger zone. You don't trust people, including the doctors. Like, I get in a room, this patient has been told by 5 other doctors, there's nothing wrong with you, it's all in your head, and so on and so forth. I go to the room, I feel the distrust.
Yeah.
So everything I say first has to pass through lots of filter before they can absorb it. And that is sometimes I have to fight first, take their concerns seriously. Once I establish trust, certainly the compliance goes up. So Dr. Bashir can tell you a lot about, a big part of med school is about what compliance is. Dr. Bashir, you want to tell us, what did you learn in the med school and so on about compliance and what the impact of compliance is in the medical care?
So basically, this is a very broad area of medical ethics. where, sir, am I right? Is it medical ethics, right?
Well, it is partially is medical ethics. A huge part of it is medical ethics to create the trust with the patient.
Yeah.
But part of that is actual hard facts. Like literally, what they do, they go and make a medication so that you have to give it only once a day instead of 3 times a day.
Oh, okay, okay.
Because we know
Got
if the compliance has many different aspects.
Oh, yeah.
But-
so actually, for USMLEs, it is actually taught to us under the subject of medical ethics.
Okay.
And you see, the most difficult questions in USMLE exams, you can ask any medical student, they'll tell you they are from the medical ethics, not neurology, not surgery, not medicine, not pulmonology, not OBGYN, they even not biochemistry, which is super tough to some. It's the medical ethics from where they ask the most, difficult questions. And regarding compliance, yes, it's basically called patient-centered care. Now they have changed the terminology to PCC, patient-centered care. And I think so that compliance is basically a part of it, because you write the medication, you write the prescription, you adjust the dosage, route of administration, according to patient's preferences, what he likes, what he wants, what fits his schedule. So everything according to the patient. And I think so. This is pretty much, actually said they don't use the word compliance in these days. They have started using the word like patient-centered care, PCC, and this is basically they have started using. But
Well,
yeah, that's
once
more.
they don't comply, then we call it compliance.
Oh yeah.
You ask them to take a medication.
Yeah.
Yeah, you ask
Yeah.
them to take a medication. They don't trust you.
Yeah.
They don't take your words seriously enough.
Yeah.
And maybe not, or they just. But what we understand about that, the best care is ineffective if they don't comply with your treatment regimen, and that treatment regimen has a lot to do how much they trust you, how much they respect you as a provider. And that is what I think, Amanda, that is the direction you are going.
So there is something called patient-physician relationship. So what sir said, when the patient walks into the clinic, it is how the physician deals with the patient according to what fits to his particular situation. That actually builds a patient-physician relationship. And in order to provide patient-centered care, PCC, the first step is patient-physician relationship. It should be effective. It should be optimized, because all the results that you are going to obtain in the days to come are actually dependent upon the foundations of that relationship, patient-physician relationship.
The trust.
Yeah, that you actually made during. Sir, am I getting it right or not?
Yes, you are.
But my concept is.
Yeah. But I think where Amanda is going now is that if you have a positive attitude, you're more open to trust people, no matter the doctor, whoever.
Yeah.
And if you have a negative attitude, you're just going to be trust less people. That leads to less or more compliance, and that will have tangible effect in actually your care, your situation. Okay, so it does
like doing your PT. If you trust your doctor, you're going to do your PT. If you think that you're a gym bro and I know more than my doctor, you won't do your PT, and it's going to be harder for you after.
And that is a big fight, actually, everyday fight we have in our clinic. So because we have level 1 evidence that physical therapy works, and then I see this patient who have been turned away, they have been just parked in a bad place, and we professionals, we doctors as well, are guilty as charged in that, because we don't really sometimes take their symptoms seriously and so on, and then they wall off. So first thing I need to do is to actually build a trust that I know you have done it before. I know you think it's not going to work. I know you're physically active, but trust me. Let that baggage away that you have brought with you. Let me guide you. Let me once in a while, let me be in charge of helping you. Like, I can't just tell you, Amanda, imagine that we were in a flight, and the flight was a little in a bad shape and so on. all the anxiety you had there, right? You
Yeah.
remember? These
Mhm.
patients are like that all the time. They're in a situation that it can go either way. And then imagine they have been in that bad situation so often, they think they should be flying that airplane.
Yeah.
Hmm.
And
Right.
then we know how that goes, they don't trust anybody. They are in the airplane, the situation is bad, but they don't trust the pilot to do the right thing for them. They're banging on the door. Let me in. I want to fly this
Right.
airplane. We all know how that goes. And that is
Yep.
where your attitude in the moment that you make those kind of decisions decides if you're even able to trust anybody or not.
Well, and that's kind of where positive thinking comes in. Like if you've been turned down by 5 doctors and you're a pessimist, you'll maybe think like, great, I'm wasting my time on the 6th doctor. But if you're an optimist, you're going to say like, oh my gosh, the 6th doctor is going to be the one. And it's going to completely change the way you view your relationship with your
Mhm.
doctor too. But
Mhm.
another thing about positive thinking that I've heard, I don't know about this, is that positive thinking can improve your pain tolerance.
Yes.
Dr. Bashir, tell us about that.
Actually, just I would like to delve into a bit of nitty gritty so that our audience can actually have some idea of it, because all of them are not medicos, but most of them are.
Yep.
So, like, first of all, the stress management, the stress hormone, the cortisol, it's created during the stress times. Actually, this neurobiology of stress, a lot of work is currently going on in it, because human beings till to date have not been able to completely understand what happens in the neuronal synapses when we are in stress. They say that, yeah, blood cortisol levels rise, but after all, those cortisol levels, let's suppose they rise, they actually are going to impact the synapses in our like neural circuitry. The second thing is, I would say, like, regarding the pain, sir, you would like to add something?
No, go ahead. I'm listening. Go.
Okay. uh, the pain. So the so there are some fibers called C fibers, A delta fibers, and C fibers. So A delta fibers are the fibers which are highly myelinated, very high velocity, and they actually take the sensation of strong pain, like the fast pinprick pain. And there are certain fibers called the C fibers. They are unmyelinated, pretty slow, and they take like a dull, throbbing pain, aching pain. So these are the two fibers so far. Probably there might be some new ones, but this is what I studied back in the time. So which actually are implicated in the pathology of pain. So it has been seen that when you do like yoga modulation, or like when there is repetitive stimulation of pain, there comes a time when certain and these fibers actually secrete a neurotransmitter called substance C, right? So which actually makes us feel hurt, there is a pain. But if when we do a massage, or when we feel good, or try to think positively, there are certain neurotransmitters, certain chemicals that are actually secreted at the same synapse in the spinal cord, which sort of make you used to that circuitry, right? That neuronal circuitry. So basically, you are in pain, but you get used to it. You no more feel pain, and then you think, oh, just it is because I felt positive, I thought positive about that particular person, or probably someone might have prayed me, that actually made me go along with this. I mean, the pain is still there. The neuronal firing is still happening. But what happens? You are getting sort of used to it because an alleviating synapse has formed in there.
Oh, okay.
Well, you are talking about the neuromodulation. That's a word for them.
Yes.
Now,
Sir got
as
it.
a matter of fact, I just today, I took a patient, I opened up their thoracic spine. I put an electrode on the thoracic spine just an hour ago. And I put the electrode there. We connect that electrode to a battery. That battery would give a small little jolt to certain part of the spine in patient's back, and that would practically reduce the amount of the pain signal that passes through. Now, we have been doing neuromodulation for thousands of years, like acupuncture, massages,
Massage.
Even talking to somebody, getting your mind like, we know that lots of soldiers, when they are in a battle, they get a bad wound. They don't even notice it. They don't have any pain until they come back, the situation is done, and so on. Then they notice, wow, I have a hole in my leg, and so on. So this idea that we can modulate the pain, meaning that pain is one of the worst kind of symptoms we treat, obviously. The idea that we can modulate the pain, that pain is there, but your emotional response to the pain, we cut the connection. Like,
Yeah.
and that has been a long knowledge that we have been using. Like in the old age, we have been using acupuncture, massages, meditation, the psychological practically realigning the patient, and so on and so forth. Now we use something called TENS unit. Amanda, do you know what the TENS unit is?
I know what it is, but I don't know like the mechanism of it.
So the TENS unit is some electrode. Actually, we should bring it in one of our next podcasts and just dialing it slowly up and see how different people react.
Mm.
You
we should.
put electrode on the skin and you put electric current through it. What it does, it activates certain neurons, and it is like you have certain amount of neurons. If you activate them in a different way, they take less attention. They pay less attention to the pain signal. It is like you have a kid with ADHD, and you give him a task that takes all his attention, so he does less mischief. Okay. Now, the TENS unit, you put it on the skin. What I did today is called spinal cord stimulation device, where I literally take part of the bone off in the back of the patient, and I put a electrode in and connect it. That goes directly to our nerves. But both of them, it works in a way that Dr. Bashir was describing, that it changes how activity of a neuron is created and transferred from periphery to our brain. But now we know even more. We can even manipulate the pain perception in our brain. There is in the middle of our head, in the midline, there is a part of the winding of the brain. We call that cingulus gyrus.
Yeah.
And practically we found out, if you literally burn some tissue in that location, or put electrode in and stimulate that, we call it stimulation, but it is like putting 120 volt on a computer. It is just making a temporary paralysis of that area. Even though we call it stimulation, it's not really stimulation. It's a temporary paralysis of the cingulus gyrus. That is why stimulation and burning a hole there with electricity works the same way. Then people separate the emotional response to the pain from the sensory of the pain. They, for example, people who have been sweating and they were in horrible pain and they could do nothing, all of a sudden they tell you, oh yeah, my pain is still 10 out of 10. Let's go play tennis. You can do that with our brain. Brain is a miraculous thing. Now, what I'm telling you, Amanda, again, goes in your direction, and I wish we had Monica as well online today. What I wish we could have that to talk about, that you don't need an electrode or a burning in part of your brain to create that atmosphere, that balance in your brain, that the perception of the pain is not as horrible.
Okay.
You can create that internally, that mechanism that weighs that signal of the pain less in your overall brain activity. And that could be positive attitude. That could be prayer. That could be meditation, not medication.
Meditation.
Yes, and then as well and it all comes back to that. You can, by your attitude, you can change the neurocircuitry of your brain to suppress the pain.
Yeah.
Okay.
This is actually what happened. This has happened back in the time, just to add synergistically to what Dr. Abbasi just said. Before the advent of all these painkillers, pain relief medications, this was how this is the beauty of evolution. right? So initially our ancestors, like millions years back, they used to feel severe pain and most of them died. The ones who survived, they actually evolved this mechanism, and today we are actually feeling. So basically, this is the beauty of evolution as well. I just want to ask a question from Dr. Abbasi. So back in second year of med school, while I was studying the neuroanatomy, I actually studied in this famous Snell's book. It's one of my favorite books, Snell's Neuroanatomy. So we have this lateral spinothalamic tract carrying the pain and temperature sensation. So it goes from the periphery to the posterior gray column, and all the way from there, it goes to ventroposterolateral nucleus of thalamus, and then to
So you're talking about the lateral spinothalamic tract.
lateral,
Go ahead.
lateral one.
Go ahead.
I have so there I read that, let's suppose if I remove a thalamus of a particular subject, let's suppose, so he or she won't feel pain, right? Because I'm actually removing that, I'm removing the thalamus. So what do you have to say? Like, let's suppose if someone has pain.
Yeah.
So
there is so-called, before we answer that, and we don't have much time, you're teasing me because you went millions of years back or thousands
Doing
of
what
years.
you do. You love going millions. He's doing it for you.
Okay, so we know from lots of, the broken bone was a common thing for a long time. We know even a few hundred years ago, when you broke a bone, you still went back to work. Okay? You know how painful broken bone is.
very painful.
We know that over the thousands of years and so on, we have become more pain sensitive. As a matter of fact, we know Americans are more pain sensitive than Indian. Our colleagues do certain surgery awake, where there's no way in the United States I would attempt to do it awake, hammer on patient while they are awake and so on. American public wouldn't tolerate that. Now, having said that, you see, oh yeah, that we are just sissies and we don't, tolerate pain. Somebody else break the pain and then go back, break a bone and go back to work. But that is one of the reasons our life expectancy is so high. If you're not pain sensitive, your life all this small damage, they accumulate and you die sooner. So
Right.
yeah, I mean, it has up and downs. Now, having said that, I almost forgot what I wanted to say. What was your question again?
If you remove thalamus.
Thalamus. There is something called, one of the most horrible thing that we have dealt with is so-called thalamic pain.
Yeah, that's what
That is a pain that is actually produced in thalamus.
Yes.
Thalamus is like a terminal. All our sensory, they go to thalamus before I get all this information. They go to thalamus, and thalamus says, okay, you go there, you go there, you go there, including our pain signals. But as well, it's more than that. As well, it's coordinate, like when the signals come from our brain for our other organ and so on to do this and that, they have to as well go to thalamus. It's like a terminal. Thalamus is a terminal.
Relay center.
Now, there are some studies that you can treat certain kind of pains that are neuropathic in nature by putting a stimulation in thalamus. But those, I don't believe we have right now the proper understanding of the relay work of the thalamus. So most of people I know, they stay away from thalamus. That is one of the tenets of neurosurgery. Stay away from thalamus. Stay away from thalamus, stay away from thalamus. Like if there are 3 rules of neurosurgery, okay, there are 3 rules of surgery. Sleep when you can, eat when you can, and don't flunk with pancreas. Okay? There is 3 rules of neurosurgery. Sleep when you can, eat when you can, and don't flunk with thalamus.
Okay.
Mhm.
Okay? So thalamus is something we should, there are
Very
some
cautious
good
of.
ideas that, certain stimulation of certain part of thalamus can have some beneficial effect, but we don't understand enough of it. So, and the chance of causing damage and then causing somebody thalamic pain, this is a pain you cannot treat with anything. these patients become suicidal
Yes.
in
Suicidal.
no time.
Yep.
Okay, so stay away from thalamus for now.
Yep, sir.
Well, I think we talked a lot about the power of positivity. I want to just end off with 2 tips for being positive. I know they're really cheesy. Dr. Abbasi's probably
Yeah.
probably sounds like nails on a chalkboard to him, but my 2 tips, they're really helpful for being positive is 1, you need to catch yourself being negative and like you need to be very honest with yourself. When you feel yourself being negative, you need to
Yes.
say something positive about what you just said that was negative.
I totally believe in the objectivity of neuronal synapses in the times of stress. Neuroscience is still answering this question. They are doing a lot of research, but I certainly believe that positive thinking, feeling good, behaving good with others actually has an objective explanation at the level of synapses.
Yep.
And it would be a great day for the mankind and particularly the neuroscience world when that objectivity is discovered. So there is an objectivity to everything. So if you are a rational in your life, you will at least try to find objectivity in every aspect of your life.
Yes.
So we are getting close. We have another meeting, Amanda.
And the other tip is that anything negative you say, you need to sandwich it with something positive. So if it's truly something negative and you can't find anything positive,
Yeah.
say 2 positive
Yeah.
things, one before and one after. Thank you guys for watching. This
Thank
was
you.
Essence of Medicine, and we talked about the power of positivity. I'm Amanda Armagast.
I am Dr. Bashir.
And I'm Dr. Abbasi for Essence. Thank you for joining
Have
us.
a positive